Hi everyone. Today I am going to present a second session on drug action. Today the first drug is Cactus grandiflorus. Cactus grandiflorus is a species of cactus known as night blooming Cereus or queen of the night. This desert plant, which is found naturally, ranges from the Southwestern U.S. to the northern Mexico. It is an evergreen succulent shrub which creeping aerial roots from the family Cactaceae. The mother tincture is made from the fresh young stems and flowers. This agent has a pronounced action on the whole organisms. Its principal action is on the heart and circulation. It produces general rigors which are followed by violent congestions, heat and sweats. These return daily. It produces sadness, apprehension, fear of death, and tendency to be frightened. There are severe constructive pains about the heart, with palpitation of the heart, oppressed breathing, constriction about the chest, pain and constriction in the region of the diaphragm, pain and numbness of the left arm. There is acid eructations, severe twisting, colic, heat in the abdomen, with bilious diarrhea and pain before the stool. The menstruation is painful, is attended with great prostration and profound melancholia. There is weakness and coldness of the extremities, with the numbness of the left arm and swelling of the left hand. It relieves congestion and remove irritation similar to aconite, but does not weaken the nervous system as aconite does. Some of the main therapeutic indication of Cactus grandiflorus are dysmenorrhea, angina pectoris, endocarditis with mitral insufficiency, hypotension, etc. The next drug is Cannabis indica. Cannabis indica is an annual psychoactive plant of the genus Cannabis in the family Cannabaceae. It is commonly called Indian hemp. Cannabis indica produces large amount of tetrahydrocannabinol. Cannabis indica is originated from South Asia, from Hindu Kush to Himalayas. The mother tincture is prepared from the dry herb tops. This agent is vasomotor and cerebrospinal stimulant, increasing the arterial tension, the intellectual and motor activity. It depresses the sensation. While it has not the power of uterine contractions, it does not increase the energy of the uterine fiber. Physiological doses give rise to a form of intoxication, during which the idea comes so rapidly that a victim believes that the time is passing slowly and minutes appear to be hours or days, short distance appearing to be a long way, etc. He has a sensation of double consciousness. Sight and hearing are more acute and the pupil dilated. Later, anesthesia appears, the reflexes are lowered and sleep and comes are present in proportion to the doses. Its after effects are headache, vertigo, dullness, forgetfulness, and mental diuresis. Death has never been observed for it, but overstimulation produces impotence and mental weakness. Some of the main therapeutic indications of Cannabis indica are headache, migraine, grinding of teeth in sleep, sterility, etc. Now, the next drug is Cannabis sativa. Cannabis sativa is an annual herbaceous flowering plant indigenous to Eastern Asia. The main psychoactive constituents of cannabis is tetrahydrocannabinol. It is commonly called hemp. It is from the family Cannabaceae. The mother tincture is prepared from the fresh blooming herb tops. This agent is quite similar to Cannabis indica in many particulars. It contains a greater amount of potassium nitrate than does the latter, and this has a more positive action upon the urinary organs. The Cannabis indica contains the greater amount of hashish, which produces greater mental disturbances. It produces more smarting and burning in the urethra than does cannabis, but less tenesmus. It acts upon the mucous membrane of the urinary tract, producing irritation and inflammation of the mucous membrane, very similar to that of specific urethritis. Some of the main therapeutic indications are amenorrhea, cataract, urethritis, gonorrhea, cystitis, etc. Now come to the next drug is Cantharis. Cantharis is from the order Coleoptera and the family Vesicantia. Cantharis is commonly called Spanish fly. The mother tincture is prepared from carefully selected insects. The Spanish fly is an emerald green beetle in the blister beetle family. It and other such species were used in preparations offered by traditional apothecaries, often referred to as Cantharis or Spanish fly. The insect is the source of the trypanoid cantharidin, a toxic blistering agent once used as an aphrodisiac. This agent, when applied to the skin, produces burning pain, hyperemia, and if the action is continued, that terminate in the sloughing and ulcerations. When applied to the chest, the lung beneath becomes pale and anemic, while if it is long continued, the pleura will show inflammatory changes. If it is applied to the abdomen for a prolonged period, peritonitis will result. When taken internally, it has a power of irritating the stomach, gastroenteritis, nausea, vomiting, and purging. It passes into blood and is excreted by the kidney, producing congestion of the kidney and irritation of the bladder. The urine may be suppressed or voided frequently when it is apt to contain albumin and at times blood. There is pain and aching in the renal region. The autopsy in fatal cases show inflammatory changes in the intestinal tract with the hyperemia of the kidney and bladder. Some of the main therapeutic indications of Cantharis are acute urinary tract infection, retained placenta, expels dead fetus, membranes, nymphomania, burns, gonorrhea, elephantiasis, eczema, etc. Now come to the next drug, Cinchona officinalis. Cinchona officinalis is a South American tree in the family Rubiaceae. It is the native to wet mountains forest in Colombia, Ecuador, Peru, and Bolivia. Commonly called China officinalis, Calicea bark, Peruvian bark. Cinchona officinalis is a medicinal plant, one of the several Cinchona species used for the production of quinine, which is an anti-fever agent. It is traditionally used in the prevention and treatment of malaria. Other alkaloids that are extracted from this tree include cinchonine, cinchonidin, and quinidin. The mother tincture is prepared from the dried bark. The action of this agent has so many features in common with its alkaloid Chininum sulfuricum that its physiological action is considered under the heading. Chininum sulfuricum externally and locally is an antiseptic preventing putrefaction and fermentation by its power of destroying fungi and infusoria in a solution of from 1/250 to 1/1000 dependent upon the organism according to the bins when given in the proportions of 1 part of 20,000 of blood. The white cells of the vessels ceases to migrate. Small dose to 3 grains increases the phagocytic power of the blood, while larger doses more than 4 grains circulating in the blood decreases this power. Medicinal dose increases the number of red blood corpuscles, while toxic doses inhibit the oxygen bearing powers of the red corpuscles. Small doses increases the force and frequency of the heart action, while larger doses slow and weaken it. And in children often causes intermittent pulse. Small dose elevates, while the larger dose depress the cardiac action. Taken internally, it has a bitter taste in a proportion of 1 to 10,000. Under small dose, the appetite and the digestions are improved. The secretions from the salivary and the gastrointestinal gland are increased. Peristalsis is stimulated and blood supply to the stomach is increased. Large doses disturb digestion, causes nausea with possible vomiting and diarrhea. It is absorbed from the stomach, not from the intestine. Its presence may be detected in the urine 15 minutes after the ingestion of full dose, but it is many hours or even days before it is finally excreted. Fully, 90% can be recovered in the urine. And small doses stimulate the cerebrum, while the large dose occasions cerebral congestion, a sensation of dizziness, fullness in the head, and unconsciousness. Small doses depress the respiratory movement, and death may be due to respiratory paralysis. This may be accompanied by paralysis of the heart vagus. It is a powerful antipyretic and malarial fever, but has a little influence on the temperature in health. Excessive dose and long continued use produces a group of symptoms known as synchronism, in which there is a sensation of fullness in the heart, fullness in the head, ringing and buzzing in the ears with a varying degree of deafness, headache, disturbance of the vision, vertigo, muscular weakness, at times deliriums, enlarged spleen, a deposition of shiver, great debility, a periodicity which is well marked and frequently hematuria, while there are no indications that it is an abortifacient. It does appear to stimulate the uterine contraction after the inspection of labor. Some of the main therapeutic indications are intermittent fever, anemia, flatulence, diarrhea, rheumatic and neurologic pains, insomnia, gallstones, postoperative gas pain, and hiccup, etc. Now come to the next drug, Coffea cruda. Coffea is a genus of flowering plant in the family Rubiaceae, commonly called it coffee. Coffea species are shrubs or small trees native to tropical and southern Africa and tropical Asia. The seeds of some species called coffee beans and used to flavor various beverages and products. The fruits, like seeds, containing a large amount of caffeine. The mother tincture is prepared from the unroasted beans. This agent is used as a beverage habitually and excessively produces indigestion with gastric acidity, vertigo, headache, cardiac irritability, and despondency. Poisonous doses produces delirium, partial loss of consciousness, a slow irregular pulse, coldness, clammy perspiration, subnormal temperature, cramps, tremors, increased urine, and diminished vision. It is employed as a stimulant to antidote the effects of narcotics. Some of the main therapeutic indications are insomnia, migraine, dysmenorrhea, toothache, etc. Now, come to the next drug is Crataegus oxycanthar. Crataegus, commonly called hawthorn, quickthorn, thorn apple, may tree, white thorn, or haw-berry, etc. It is a genus of several hundred species of shrubs and trees in the family Rosaceae, native to temperate regions of the northern hemisphere in Europe, Asia, North Africa, and North America. The mother tincture is prepared from the ripe berries. This agent acts upon the heart as a destructive tonic, produce a quieting and strengthening influences, and imparts tone and force to the cardiac contractions. It is a solvent and absorptive to the disease accumulation and tonic and stimulative to its native nerve supply. The main therapeutic indications of Crataegus is angina pectoris, cardiac hypertrophy, hypertension, diabetes, especially in children. Now, let me conclude for the time being. The remaining portion of the chapter, drug action, will be continued in the next section. See you in the next section. Till then, goodbye.
Thanks for watching.
Like,
Comments
share,
and
subscribe.